We good? Are we live?
We're live.
Here we are.
Here we are.
Hey, Tyler.
Should we be doing this? Yeah, I guess we're doing this.
I'll do it. Yeah, that's good.
Hey, welcome to the Right PT Facebook Live. We're happy to be here. Kate Anderson and myself. Kate Anderson, Doctor of Physical Therapy. Tyler Billings, Doctor of Physical Therapy as well. Both owners here at Right Physical Therapy. We're happy to be here. Cade, congrats. Cade just got a recent promotion. He is the regional director over all three regions, Boise, Magic Valley, and Eastern Idaho.
Yeah.
So that's pretty exciting times.
Appreciate it. Yeah, thank you.
Yeah. So it's great to have Cade Anderson in that role, and his skills and abilities of what have brought him into that role. And clinically, those who know Cade Anderson is a very good clinician. And we're going to be talking today about dry needling. So dry needling is a question of how it can help me. You've probably seen on Facebook the offer that we have. It's really incredible. 4 dry needling sessions for $90. That is 50% off. So take advantage of that opportunity. And man, it's hard to breathe in this thing. And making sure that you're able to see the benefit of that. Dry needling is a super powerful tool. So let's just jump into that. Cade's going to do a demo and show how it's done on the head and the neck and for headaches. But let's talk about a little bit what dry needling is. Is that cool?
Yeah, absolutely.
So dry needling is a thin monofilament. We
got a few
right here. So a thin, still in the package there. So it's a thin monofilament needle, very similar to an acupuncture needle, where it penetrates into the tissue. So we've done several Facebook Lives on this, but we're going to continue to educate on this. So what it does is it penetrates into the ailing tissue, and it's going to stimulate collagen growth, right? Collagen is a form of protein in our body. It makes up the whole matrix of how our body functions. So it goes into that region. It stimulates circulation, blood flow, collagen growth, like I mentioned, improved mobility. What else? I mean, there's numerous, decreases pain and inflammation. So it's a very effective tool when done in combination with physical therapy, right? So just stand alone, dry needle into the tissue isn't going to be as effective as combining it with skilled physical therapy and the interventions that are needed that way. A lot of people ask, Cade, what's the difference between dry needling and acupuncture? What would you say there?
Yeah, so, I got to be honest, I'm no expert in acupuncture, but I've done plenty of research, have a good idea of what it is. So acupuncture is Eastern medicine, and so it's different. In acupuncture, there are meridian points on the body that are in certain locations. And what they will do is they will actually stick the needles into these meridian points in different parts of the body. And it's all about the transfer of chi and energy throughout the body to heal things, right? So that's what acupuncture is. It's very specific spots in the body that they're sticking the needle in. Typically, there's not a lot of manipulation in the needle once it's in there. Now, dry needling is more of the Western medicine version of acupuncture. So we actually go to specific tissue that's the problem, right? So we find the tissue that's the issue. That rhymed. That was cool.
Wow, that was
I've never done that before.
Good job.
And so a lot of times you guys have felt this. Maybe you felt a trigger point up in here, and when you press on it, it's just like, wow, that elicits a headache pain to me.
Yeah.
That hurts right there. That is very sensitive. We would find trigger points, tissue, that are having issues, and we will stick the needles directly into them, and that's what starts this cascade of healing factors that will come from the brain by increasing blood flow, by reducing tone or the kind of tense condition of the muscle, right? Allows it to relax and calm down a little bit, and allows the tissues to then start to basically move normally, right? Now, ultimately, like Tyler said, the dry needling is great to reduce the motion or to reduce the pain and improve the motion, but something caused that ultimately, right? Like there was some root cause, either in the way that you move or some dysfunction within your body that ultimately caused the muscle to get knotted up like that. And so it's best when it's combined with physical therapy that gets to the root cause of your pain and addresses it. That's when you're going to see the best long-term effects from it.
Yeah, I think that's well said, because if you think about it, tendon, right? A tendon connects muscle to bone. If the dry needle comes into that tendon where the trigger point is, like Cade says, you got to know why is that trigger point there? Trigger point, in essence, is just a fancy word for a muscle being bound up, really, in all honesty. The muscle is bound up. It's not functioning the way that it needs to. But is that the problem? Is it the chicken or the egg, right? Like what is causing that issue? And so we need to understand that, and that's why physical therapy combined with dry needling is so important, because if not, you're literally, no pun intended, stabbing in the dark on those things, just going, I hope this works and let's see what sticks. That's never, ever going to work, get to the solution of your problem. That's the whole point of why Right PT exists, to be honest. That's the whole reason Right PT grows, is because the communities need to know that we serve, that we have real solutions for those problems, right? We're getting to the root of your pain. We study it for years and months and weeks and days to understand how the body functions and how it correlates with healing. And there is a healing process, right? Our own CEO, sorry, Brian, injured his Achilles tendon, right? It's hard to kind of rehab yourself. Even an owner of a PT practice, like when it's your own injury, PTs, we always say as a joke, we're like the worst patients sometimes.
Yeah, absolutely.
But we've all been able to assess Brian and his Achilles and use it as a research study to say, hey, when is it appropriate to be out of the boot? And when's it appropriate to do this? Like you'd think, like as a PT, we're like, oh, you gotta be running and jumping in like 2 weeks. Like it takes time for tissue to heal. There is science behind that. We study that. Like you can't just say, well, I want a PT practice, so now I can get back to playing basketball because I know the body. Like, yes, we know the body, but sometimes you can't just heal something overnight, right? Tissue has to be progressively loaded. It has to apply the right science. And when you do that, that's where the healing process takes place.
Yeah, for sure. And what we wanted to look at today, we wanted to get into some specifics. So we've held a couple of these videos discussing dry needling, and we're going to continue to go over it because it's been an incredibly powerful tool for us. It's been incredibly effective for people. It's changed people's lives. And last time we specifically did at the elbow. We talked about lateral elbow pain, tennis elbows. A lot of people have heard it be called, and we talked about how we can affect that. One thing we want to go over today is headaches. And so a lot of people struggle with headaches. It's something I hear all the time. I scroll through social media and I'm hearing people asking for remedies about Facebook and about headaches, and just something that I see quite a bit that people struggle with. I've personally struggled with headaches quite a bit in my life as well, so I'm sympathetic for people going through it. It's not fun. It's not fun at all. Now, there's different types of headaches. Certain headaches can be treated really well with physical therapy. Others might need different means of what would need to help and treat them. The specific type of headache we want to talk about today is what's referred to as cervicogenic headaches. And so cervicogenic headaches, to give you an idea, is typically unilateral, meaning it'll be on one side, okay? It'll kind of come around the ear. They call it like I believe a ram horn presentation that comes around just like this. I always think of the Los Angeles Rams and their helmets, just like that. And that's the kind of the presentation of what the headache will look like. It'll really center right into the eye or right above the eye right here. And ultimately, it stems from the neck, the cervical spine, which is why it's called cervicogenic headaches. Yeah. Now, that dysfunction, it typically happens from a dysfunction in the upper cervical spine. So we're talking about the first, second, and third vertebrae of the neck up here. That's referred to as the upper cervical spine, and there's some kind of a dysfunction either where it's locked up, it's not sliding and gliding on the facet joints like it's supposed to, and so there's some kind of a dysfunction that's causing that radiating pain through a nerve distribution into the front part of the head right here. And so to give you an idea, it's typically pretty severe in nature. A lot of times it can be mild, but typically when you get a cervicogenic headache, it is pretty severe in nature, and it's right here, and it's actually affected either by neck position or neck movement, to give you an idea. So some few common things you'll see it with. Maybe you guys have seen this before. You're sitting at your desk, you're working at your computer, and you're doing one of these guys. As you can see here, I've created a upper cervical extension right here, a cervical flexion with upper cervical extension motion on my neck, which can cause some dysfunction and some irritation to the musculature in that area, which will refer into the head. That would be one that I see quite a bit. It might be with specific movements where, at work, maybe you work and you're a driver and you're constantly having to look back like this, and as you keep doing that over and over and over again, you start to have this headache that comes on. But it ultimately stems from neck movement or neck positions. That's important to distinguish. With those type of things, dry needling is actually extremely effective to help reduce the headache. Now, another type would be migraines. Migraines actually look pretty similar. So people sometimes get confused between the two. Migraines typically also are unilateral, kind of here on the front of the head. The difference would be that when you have migraines, you typically have quite a bit of nausea, dizziness, and a lot of other things like that going on. You can have a little of that with cervicogenic headaches, but for the most part, with a migraine, you would have a little bit different symptoms, but they actually can be just as severe. So a lot of times, the way I grew up was like, I have a headache, but when it was really bad, I had a migraine. That's what I thought it was, right? Like, this is a severe headache, so it's a migraine. There are different causes of them, but cervicogenic headaches are extremely common. They estimate about 60% of headaches are cervicogenic in nature. And so if you're having headaches, this might be something we could possibly look at to possibly help you.
Yeah, and I think one last component here we're seeing a lot of, I don't know, it's funny how this ebbs and flows, but TMJ, TMD, so a temporomandibular joint that's right here, the jaw, when it opens, right, is here, and how it hinges there. We're seeing a majority of those who have these TMD, these jaw issues up here just below the ear, are actually coming from the neck. Because like Cade said, when my neck is forward like this, that now puts pressure here on the muscle, the ligaments, and the actual joint itself. So dry needling is also very effective in treating these TMJ, TMD issues when addressing it in the cervical spine and into the jaw region.
Yeah, so Tyler's been nice enough to volunteer his body for science.
Body for science, that's what I do.
We're going to show you what it looks like to do dry needling in the upper cervical spine and how that might help for headaches. And so, Tyler, let's go ahead and have you lay down right here for me, okay? And we're going to look at this. Tyler's dry needled me before, and he's always been very gentle and kind.
Very gentle and kind.
And so
always.
I'm going to pay him the favor and also be gentle and kind to him. And so, Rebecca, I'll come around right into here. And so, can you actually unbutton your top button there, Tyler?
Yep.
Just clear a little bit of
Sorry,
space.
I'm dressed so nice for this occasion.
Yeah, this isn't ideal, but we'll make do for what we have. Oh, Tyler's got the Slim Flex fit. Just thought we would point that out. That's why it looks so good. So what we're going to look at, like I said, most dysfunction that happens in the upper cervical spine happens within the first 3 segments right here. And so as I'm rolling down here, I'm coming down into what are called our cervical paraspinals, which is frequently can be irritated through postural issues that we might have. And what we're going to do is we're going to go ahead and start with Tyler right here. We're going to take the needle, we're going to tap it in. You might notice he didn't even jump. He probably didn't even feel it go in. And we're going to push in to right there. So as you can see, Tyler, how did that one feel?
Great.
Sometimes you're a little nervous having somebody stick needles in your neck, but honestly, the majority of feedback I get is, did you put it in? They're not even sure if I put it in here. It can actually be quite a gentle way to do this. And so I'm coming now up into their second cervical spine. We're going to be going right off the edge into a muscle called multifidus, which also is a major contributor to the stability of the neck as well as postural control. And we're going to be getting it right into there. Like I kind of discussed, typically it's going to be unilateral symptoms. It'll be one side is quite a bit worse than the other. And so typically we'll work one side through here. Now the biggie, this is probably the one that I would say causes the most headaches, that refers to the head most, would be what are called the suboccipital muscles. So the suboccipital muscles, if you can come up for just a second, Rebecca. The suboccipital muscles, what they do is when you have this forward head posture, but you still got to look up at something, you have this slight little chin nod up. That is activated by the suboccipital muscles right here, which create upper cervical extension. Those can get overworked when you're having, when you have poor posture, when you're sitting at a desk or whatever you're doing. And so this is a great way to hit and take care of these. And so you would come actually, and obviously you have to know the anatomy, which is why you need to have a skilled physical therapist that's gone through this training to be able to do that. But this, in order to hit those suboccipitals, would be hit right there. Now, as we talked about, as we stick the needles into these locations, we're going to come in here, we can manipulate the needle. What we're ultimately trying to do is we're trying to get a histamine release, which is a hormone that further signals to the brain, hey, this is the area that's having the problem. We need increased blood flow into this area. We need relaxation to this area. There's this descending effect from the brain through the spinal cord into this area to alert the brain this is the spot that needs to heal. And so this is ultimately what we're trying to do with dry needling. And we've seen a really good effect on headache pain when implementing this with people. So I'll go ahead and pull these out so that Tyler can get up. Okay, Tyler, you are done. So go ahead and take your time getting up, and then we can wrap things up.
Professional.
And Tyler, how'd that feel?
Felt great. It actually, a common response to dry needling is actually where it releases a hormone to cause relaxation and sleep. So Kate almost put me asleep there. Like honestly, it makes you just relax and feel calm. I barely even felt it when it went in, to be honest.
You should go back to your office and have some Arby's and get some meat sweats and take a nap.
Oh, Arby's, that does sound good actually. Why'd you do that to me? So yeah, I mean, super effective treatment here. In closing, you know, dry needling isn't just for headaches. I mean, obviously the discussion today was about headaches, and it actually felt really good. I needed some of that. You know, we treat it in all areas. You got jumper's knee, you got hip issues, you got lateral elbow issues, golfer's elbow, right? It's about to become warm weather here. Golfer's elbow.
Low back pain
low
would
back
be one we use a
pain.
lot.
Plantar fasciitis, super effective for that.
Yeah.
Any sort of rupture issues you've had, like in the calf region. I mean, we could go on and on. There's multiple areas where this is effective, but the take-home message is you need a licensed, skilled physical therapist who knows what they're doing, who's been fully trained, that can diagnose, then prescribe, right? Part of dry needling can be diagnostic, to be honest. We work with local doctors. They'll sometimes send patients in for tendon issues and have us put a dry needle in there so we can do some diagnostic testing through the dry needle. You also can attach electricity to the dry needling, which I've done is super comfortable, like on my hip. So you can run an electrical current through those needles as well, so you get deep stimulation. So if you what other question or what other thoughts do you have? And those are my kind of take homes.
You know, I think just to be clear, this is not something you need a referral from. So we actually do offer cash pay services where you can come in and be assessed by a doctor of physical therapy and be seen and be dry needled. We also offer that with manipulation, or what's better known as popping and cracking, right?
Yes.
Of the spine. We refer to it as manipulation because there is some skill and some reasoning behind that. With any type of soft tissue mobilization and anything you need, we offer cash pay services where you don't necessarily have to have a referral, and you can come in and be assessed and you can be taken care of with those regards. And so we do have the splinter offer right now, 4 visits for $90, right? Which is an incredible deal. You're not going to find anything better than that, but please consider that if you're struggling with headaches or any other part of your body that you're concerned about. Please reach out to us and we can help you out.
Yeah, look us up, rightpt.com. We have 13 clinic locations. Facebook, I don't know if there's any questions, Rebecca, on Facebook.
That was easy.
We'll be posting a blog on dry needling. We have a few blogs on that. We'll be posting that. But yeah, feel free to reach out, and we look forward to hearing from you. Stay safe.